So in a nutshell, if a dentist is watching this and wants to do the right thing and upskill themselves, do they contact the Australian Dental Association and say, hey, let's do some training? What's the message?
There's probably three opportunities. So one is to contact, if you've got a patient and they've been diagnosed and they've had their treatment, one of the things you can do is actually contact the surgeon, but the surgeon should be able to know who was the dentist as part of that multidisciplinary team, so that dentist can go and directly liaise with that specialist that was involved in that patient's care. Now, one of the things I do in South Australia here is that when I see these patients on referral from the medical team or the multidisciplinary team, I will write a referral back to that patient's general dentist saying, this is what the patient had done, this is what we need to worry about, these are the issues for you. And there's been a means of communication that that patient's dentist knows who it was that looked after them. So that's one side of it. There is continuing professional development on that. The Australian Dental Association federal body has a CPD or continuing professional development portal. And there's plenty of stuff on there about head and neck cancer, human papilloma virus and things like that. People like myself are also called to give presentations on that, and so the Australian Dental Association has a conference every 2 years. There will be at least one presentation on cancers in general. And certainly next year I go to Sydney and I'm involved in the conference and doing exactly that. So there is often that as well. And then the other thing that happens is people like me are also involved in training as well. So I do undergraduate training, I teach the postgraduate specialist program. The thing is, Julie, that we're a relatively new specialty, and as you said, in the past, head and neck cancer was very much about smoking and alcohol exposure. We're seeing a different type of cancer come through. The treatments have been de-escalated for the HPV cancers, and that means we need to be able to have that ongoing training. So one of the things I did in South Australia was to develop a network in the public sector and trained up about 25 dentists around the state. So we had a means to step down within the public system. And I've sort of done the same thing in the private practice that I look after at Health Partners. We've got 3 locations around the city, and I have dentists in each of those locations that can look after my patients ongoing as well. So that's something that's being, I guess, similarly done in other states and territories as well.